In today's health headlines, can gardening prevent dementia? New research on an early intervention for Alzheimer's, and what to know about the link between vascular disease and dementia. Joining us is Dr. Arman Fesh-Araki, Yale Medicine behavioral neurologist and neuropsychiatrist and assistant professor at the Yale School of Medicine. Welcome, doctor.
Thank you very much for having me. I appreciate it.
Anytime. We appreciate having you here. A study found that gardening may be protective against dementia. Why is this?
So again, keeping in mind that there might be slight selection bias, but it really paints the bigger picture. So someone at 79 who does gardening is someone who's been active throughout their lives. So the idea that exercise has significant cognitive and emotional benefits, and it can also even prevent potentially the onset of Alzheimer's and other types of dementia. So the result is very encouraging, and it's not all that surprising.
An early intervention window for Alzheimer's disease has been found in recent research. So what do we know about that?
So the idea that midlife risk factors, so meaning that, for example, having high blood pressure in your 40s or 50s is a strong risk factor for Alzheimer's and other types of dementia. So the idea that being hypervigilant about controlling these risk factors, be it exercise, regular diet, Mediterranean-based diet, keeping your brain active. So all those measures that I speak to all my patients about in the last few minutes of our sessions can go a long way. So this study that was published recently essentially is a microcosm of a greater picture of being active on all levels, has significant benefits.
That's great information. And there's new evidence indicating that blood vessel damage in the brain is linked to dementia. What can you tell us about that?
So there was a fascinating large-scale study published out of JAMA, Journal of American Medical Association, Open Network, looking at 75,000 plus Alzheimer's patients. And what they found was increased white matter lesions. What that means is atherosclerosis in the blood vessels of your brain is actually associated with increased risk of dementia, including Alzheimer's. And Catherine, I can't tell you how often, when I look at the MRIs of our patients in a clinic, I see quite a few of them having these small lesions around what we call ventricles, these compartments we all have in our brains, indicative of atherosclerosis in the brain. Our high-fat, high-carbohydrate American diet and poorly controlled blood pressure, unfortunately, can wreak havoc. So being hypervigilant about these risk factors is very important.
All right, a lot of ground that we just covered. Thank you so much, Dr. Arman Fesh-Araki. We appreciate you being here.
Thank you very much for having me.